Rather than helping the homeless, they target them. They push them around, move them from spot to spot.
Criminalization?
Yeah.
So
This has all started
Go
in
ahead.
the early 1980s. I came out here in 1989. Been out here since 1990.
How do you sleep out here?
It's tough. It's hard to find shade, stay cool, and
Note: to help viewers gain a clearer, more objective, and comprehensive understanding of the impact of social ills, we may use images from other areas with similar conditions and situations. If you live or are present in such areas, please share your observations and opinions in the comments section. These contributions will help us improve and update the content in future videos. Thank you. With warm sunshine, beautiful beaches, and a dream destination for millions, Florida is growing faster than most states, and the U.S. population is increasing. Construction is expanding, and coastal cities are constantly developing. But alongside this growth, another reality persists: homelessness. According to the U.S. Department of Housing and Urban Development, HUD Annual Homeless Assessment Report, and data compiled from the Florida Council on Homelessness in 2025, Florida remains among the states with the highest number of people experiencing homelessness in the U.S. The most recent point-in-time report recorded nearly 30,000 people in this situation on a single January survey night, including those in shelters and those in temporary spaces. However, official data also shows a noteworthy signal. The statewide total has decreased by approximately 9% compared to the previous year, according to the State Council report. This raises an important question. Is Florida controlling this trend? Or is it just temporarily pausing in the face of pressures from housing prices, population growth, and economic volatility? In today's video, we will rely entirely on HUD data and official reports from each region to identify the 10 places in Florida with the highest homelessness rates and analyze what is really going on behind those numbers. No speculation, no exaggeration, just verified data and what it says about the future of this state.
Miami-Dade County.
Leading the list is Miami-Dade County, the state's largest metropolitan area. According to the latest point-in-time data released by the Continuum of Care FL 600 system and reports from the Miami-Dade County Homeless Trust, the area recorded 3,728 individuals experiencing homelessness in the most recent survey. This number keeps Miami-Dade as the locality with the highest total in Florida. However, it is noteworthy that according to local reports and HUD analysis, the majority of those recorded here are in official shelters, rather than being completely homeless. This is a distinguishing feature compared to some other major cities nationwide. Miami-Dade has long adopted a housing-first model, focusing on providing people with stable housing before addressing other social factors such as employment, mental health care, and support for reintegration into the community. Recent reports suggest this approach has helped to curb the sharp increase in recent years. However, the area remains under significant pressure from rising home prices, some of the highest living costs in the state, and rapid urban development. According to real estate market data cited by numerous economic analysts for 2024 to 2025, Miami continues to be among the fastest growing cities for rent in the southeastern United States. Therefore, despite the positive impact of the intervention programs, Miami-Dade remains a hot spot to watch closely in the coming years.
Orange, Osceola, Seminole,
Looking back a few years, the Orlando metro area saw a relative decrease in the number of homeless people thanks to resettlement programs and emergency assistance following the previous recession. But now, according to the latest point-in-time statistics compiled by the Homeless Services Network of Central Florida and reported to HUD, the FL 507 area, encompassing Orange, Osceola, and Seminole, has 2,781 individuals in precarious housing situations. What does this shift reflect? In the past, the Orlando housing market maintained relatively affordable rental prices for workers in the service and tourism industries, two of the area's main economic pillars. However, after the pandemic, rapid population growth, high housing demand, and escalating living costs have created an increasingly wide gap between income and rent. According to housing analysis reports from HUD and local agencies, rent increases in Central Florida over the past few years have been among the highest in the state. With rent accounting for a significant portion of income, savings are virtually non-existent. Compared to previous periods, the support system now faces more complex issues. Not only housing shortages, but also accompanying mental health crises, job insecurity, and the impact of social ills. This makes the recovery process prolonged and requires multi-layered resources. The past shows that the region was once able to control the upward trend. The present presents a greater challenge as economic, demographic, and real estate market pressures converge. Comparing the two periods, it's clear the issue isn't just a short-term cycle. It reflects a changing economic structure. The question then arises, are policies that were effective in the past still sufficient to address the new context of Orlando Metro today?
Broward County.
2,636 individuals. That's the number of homeless people recorded in the most recent point-in-time statistics for the FL 601 region, according to data reported to HUD and coordinated by the Broward County Homeless Initiative Partnership. But if we put this number into the broader economic picture, we see clearer lines. Broward County is one of the most populous and dynamic areas in South Florida, with an economy heavily reliant on tourism, services, and real estate. However, according to analyses by the Florida Housing Coalition, rents in many South Florida municipalities have risen sharply in recent years, while average wages for service workers haven't increased proportionally. What does that gap create? A prolonged state of insecurity. When a large portion of monthly income goes towards rent, workers have virtually no financial buffer. A single disruption, such as reduced working hours, rising medical costs, or market volatility, can derail them from their stable trajectory. According to HUD, rising housing costs are one of the most significant economic factors contributing to homelessness in many major U.S. cities. Broward is no exception, especially given its continuing population and limited supply of affordable housing. The bigger picture shows this is not just an individual problem. It's a consequence of a malfunctioning labor market, real estate prices, and social security system. Therefore, 2636 doesn't just reflect a group of people in need of assistance. It reflects the accumulated economic pressure in a rapidly developing region, where growth and imbalances coexist.
Pinellas County.
Looking at a map of the Tampa Bay area, Pinellas County is known for its famous beaches and thriving tourism industry. However, according to the latest point-in-time count report from the Continuum of Care System of the U.S. Department of Housing and Urban Development, HUD, the FL 502 area recorded 1,860 people without stable housing in a single night of survey. A distinctive feature of Pinellas is its high population density coupled with limited land. As a narrow peninsula, the supply of affordable housing here hasn't kept pace with demand. According to county planning and budget reports, the proportion of affordable rental housing for low-income earners remains at a persistent shortage. This leaves many service workers, particularly in the tourism and restaurant sectors, vulnerable to precarious situations as working hours are reduced or the cost of living skyrockets. Unlike some other areas, Pinellas also records a significant proportion of people living in temporary housing, such as cars or other unsuitable long-term living spaces. Community organizations report that these individuals often require simultaneous support for housing, employment, and mental health care. Some cases are further complicated by the vicious cycle of social problems, making the recovery process even more difficult. In response to this reality, the county government has expanded its short-term rental assistance program, developed more long-term housing units, and increased coordination between the health system, social services, and nonprofit organizations.
Hillsborough County.
When rent prices in Tampa rise faster than average incomes, what happens next? According to the annual Continuum of Care census of the U.S. Department of Housing and Urban Development, HUD, the FL 501 area, which includes Hillsborough County, recorded 1,796 people experiencing a shortage of safe housing in the most recent nightly survey. The first impact begins in the labor market, as apartment rental costs surge in the post-pandemic period. According to Tampa Bay real estate market reports, many service workers have to spend a large portion of their income on housing. This reduces their ability to save, leaving them with virtually no financial buffer against disruptions such as reduced working hours or increased medical expenses. The second impact spills over into the education and healthcare systems. Children and families living in precarious housing conditions often change schools multiple times, while hospitals and community support centers report an increased need for mental health counseling. Some cases are also affected by the vicious cycle of social problems, making the process of stabilizing their lives even more complicated. A third impact is the pressure on local budgets. The county government has had to expand emergency rent assistance funds, develop more supportive housing units, and increase coordination among social agencies. However, each measure requires long-term resources. Therefore, 1,796 people is not just a statistic. It is the starting point of a chain reaction, from the housing market to schools, hospitals, and public budgets. Hillsborough shows that when the cost of living exceeds the affordability of a segment of the population, the impact doesn't stop at the individual. It spreads throughout the entire community structure.
Palm Beach County.
1520. That's the number of people recorded as experiencing a lack of safe housing in the most recent annual census in Palm Beach County, according to the Continuum of Care system of the U.S. Department of Housing and Urban Development, HUD. But 1520 is not just a total. That includes people living in temporary housing facilities, and also those in non-permanent, unsuitable living spaces. According to analyses from the Palm Beach Post and local reports, rental prices in South Florida have risen sharply in recent years, while the supply of affordable housing for low-income groups remains limited. The gap between income and housing costs continues to widen. Another noteworthy figure: the percentage of households in the county spending more than 30% of their income on rent is high, according to census data and local housing planning reports. When a large portion of income is spent on housing costs, the ability to cope with financial fluctuations is severely limited. Social services agencies in the county are also reporting increased needs for mental health support, along with cases affected by social problems. This results in longer recovery and reintegration times than before. 1520, a seemingly quiet number, actually reflects multiple layers of pressure: the housing market, the cost of living, and the community support system. And as these numbers continue to be updated each year, they not only reveal the scale of the problem, but also raise questions about the speed at which policies can adapt to the rapid changes in South Florida.
Volusia Flagler.
6 a.m. in the Volusia and Flagler County area of Florida. According to official reports from the Florida Department of Children and Families and the latest point-in-time count data from the FL 504 Continuum of Care System, 1188 individuals have experienced homelessness in the past year. A typical day for the support system begins early. At emergency reception centers, social workers review lists, update records, and identify those needing priority access to medical services, job search assistance, and counseling for those experiencing prolonged mental health issues. The atmosphere is quiet, but the pace is hectic. By mid-morning, local organizations coordinate with county authorities to allocate resources. Temporary housing, food stamps, legal support, and treatment connections for those affected by social problems or behavioral health issues. According to a report from the Florida Housing Coalition, the Central Florida coastal region is under immense pressure due to soaring rental costs over the past few years, leaving many households in precarious housing situations. In the afternoons, community outreach teams move into public areas, talking and building trust. Not everyone is ready to enter the support system immediately. Some have experienced severe financial harm. Others are trying to recover from personal trauma. As night falls, shelters check capacity. The number of beds is always a difficult problem. The system continues to operate quietly, continuously, with the goal not just of providing a place to sleep overnight, but of opening a path to long-term stability. In Volusia and Flagler, the story isn't just about the 1188 numbers. It's a day repeated every day, in an effort to bridge an increasingly apparent welfare gap.
Brevard County.
According to the most recent point-in-time count data compiled by the FL 513 Continuum of Care System and reported by the Florida Department of Children and Families, 1062 individuals in Brevard County were in a state of homelessness in the past year. Among them are veterans who served their country but are now struggling with rising living costs and persistent mental health issues. There are families with young children where parents work part-time, but their income doesn't keep up with the rising rents in coastal Florida, a situation noted in numerous local reports and HUD analyses amidst the volatile post-pandemic housing market. Another noteworthy group is those facing mental health crises or affected by social problems. They need not only shelter, but also counseling services, behavioral health care, and support for reintegration into the community. According to HUD reports, nationwide, the rate of homelessness linked to mental health issues remains high, and Brevard is no exception. Notably, Brevard County also has a relatively large proportion of senior citizens compared to many other counties in Florida. When fixed incomes fail to keep up with the cost of living, a single medical event or part-time job loss can plunge them into home insecurity. The profiles of these 1062 individuals are not all the same, but they all share a commonality: They are at the crossroads of economic, health, and housing crises. And for each vulnerable group, the solution cannot simply be temporary shelter. It must be a sustainable recovery plan, tailored to their specific circumstances.
Jacksonville area.
Numbers never stand alone. That's how experts at changing homelessness, the coordinator of the FL 510 Continuum of Care system, described the 1,008 individuals currently without stable housing, according to the latest point-in-time statistics reported to HUD. According to housing policy analysts, Jacksonville is facing a double whammy: a rapidly growing population, while the supply of affordable housing hasn't kept pace. Reports from HUD and local agencies show that rental costs in many areas of the city have increased significantly over the past few years. When incomes don't rise proportionally, a single event like job loss or medical expenses can push an individual out of a stable situation. Local sociologists emphasize that this isn't simply a lack of housing. It's an intersection of the labor market, mental health care, and welfare system. A portion of the 1,008 individuals are facing prolonged mental health crises. Others are affected by social ills or disruptions in family support networks. Policymakers believe that an effective solution should be based on a housing-first model, prioritizing housing stability first, then implementing supplementary support services. This approach has been noted by HUD as effective in reducing prolonged homelessness in many major cities. From an expert perspective, 1,008 is not just an annual statistic. It is an indicator that the social security system is under pressure. And without a long-term strategy combining affordable housing development, behavioral health support, and sustainable job creation, that number will continue to fluctuate in a worrying direction.
Manatee, Sarasota.
If 966 people in a coastal community lack stable housing, the question is not just why, but also where does the future lead? According to the latest point-in-time statistics compiled through the Continuum of Care FL 500 system and reported to HUD, the Manatee and Sarasota areas have recorded 966 individuals experiencing housing insecurity. But what happens when rental prices in coastal counties continue to rise, while the supply of affordable housing doesn't expand proportionally? Recent analyses of the Florida housing market show that escalating living costs have put significant pressure on low-income workers and seniors living on fixed benefits. Is the current Social Security system adequate to prepare for unforeseen events such as job loss, health crises, or mental health breakdowns? When an individual falls into a spiral of financial hardship and social problems, the recovery process often requires more than just short-term solutions. Another question experts are asking is, are communities willing to invest long-term in sustainable housing models that incorporate behavioral health support and vocational training, rather than focusing solely on temporary solutions? 966 is not a fixed number. It could decrease if policies are on the right track, but it could also increase if risk factors continue to accumulate. The future of Manatee and Sarasota will be shaped by today's decisions, from local budgets and housing planning to how communities view those on the margins of social stability. And the biggest question remains, in what direction do we want that number to change in the next 5 years?
Is Florida heading toward a California-level crisis?
Florida is at a critical juncture. According to recent data from the U.S. Department of Housing and Urban Development, HUD, and analytical reports from the Miami Herald and Tampa Bay Times, the number of homeless people in Florida has rebounded after a temporary downturn during the pandemic. The rate of increase in rental costs in cities like Miami, Orlando, and Tampa has been among the highest in the nation for the past 2 years. The question is no longer, is there a problem? But rather, how will Florida respond? In California, many policy experts warned for more than a decade before the housing crisis became apparent. The consequences didn't appear overnight. They accumulated over years of insufficient affordable housing, an overwhelmed support system, and gaps in public health care. Is Florida following a similar trajectory? Or is there still time to adjust? Some signs suggest the state government is attempting to intervene sooner, from allocating more budget to rental assistance programs to expanding community-based mental health services. However, many urban researchers emphasize that short-term solutions will be insufficient without a long-term strategy for planning, affordable housing, and income stability. The issue isn't just the numbers. It's the speed of response. If rents continue to escalate faster than average incomes, if low-income families continue to face prolonged financial pressure, and if support systems aren't strengthened in time, Florida could face even greater social pressure in the future. But there's another possibility. Florida has the advantage of seeing lessons from other states. The state has the opportunity to adjust policies while the crisis is still in a manageable phase. So, which scenario will the future lean towards? An effective early warning system? Or a vicious cycle of persistent challenges? The answer doesn't lie in a news bulletin, a term in office, or a short-term budget. It lies in how Florida chooses to act, starting now.